headlines. Finance Minister Nirmala Sitharaman to announce third tranche of stimulus package today. Delhi records highest single-day COVID-19 spike with 472 cases on Thursday. "1,061 Maharashtra police personnel have tested COVID-19 positive so far. And World Bank approves $1 billion for India as social security fund for urban poor migrants. Hello and good afternoon. Welcome to Times of Manipur. You are watching News Today at 1 p.m. and this is HARIPRIYA giving you the news in details. Finance Minister Nirmala Sitharaman is all set to announce the third tranche of the government's mega economic relief package today. According to media reports, the focus today will be on the hospitality sector. The hospitality sector has been severely hit in the wake of the nationwide lockdown since March 25. The entire sector continues to urge the government for fiscal support as their operations are strictly prohibited due to the lockdown orders. Cash flow has severely dried up with no revenue inflows, and several hotels owners have requested the governments to announce some form of monetary support to help them get back on their feet. Besides a direct stimulus package to support employees, many of whom have lost their jobs, another demand that has been specified by the hospitality industry is related to a 6-month suspension of GST payments. While the announcement for the reviving the hospitality sector remains to be seen, the government has already announced significant support for micro, small and medium enterprises, MSMEs, migrant laborers, farmers and middle class among others. Delhi witnessed its highest single-day spike of COVID-19 cases with 472 recorded on Thursday. As per media reports, the surge takes the city's COVID-19 tally on 8,470. Before this, the highest number of cases recorded in a single day was 448 on May 7 last. Delhi breached the highest single-day spike in case numbers for the fourth time in May, according to media reports. From just over 3,500 COVID-19 cases recorded till April end, the numbers have shot up with nearly 4,500 cases being recorded in the city in just 14 days. At least 500 healthcare workers in Delhi have tested positive for COVID-19 so far. 9 more deaths have been reported in the national capital till yesterday today. However, none of these were recorded in the last 24 hours, according to the report. Maharashtra police said today that 1,061 personnel of the force, including 112 police officers, have been tested positive for COVID-19 so far, a media report said. Out of the total infected police personnel, 174 have been cured, while 9 others lost their life. Global deaths due from COVID-19 have now crossed 3 lakhs, while confirmed cases of the coronavirus infections are nearing 4.5 million, according to Reuters. India's tally of COVID-19 cases is nearing 82,000, including 2,649 deaths, according to the Union Health Ministry figures released on Friday morning. However, the number of COVID-19 tests carried out in the country crossed 2 million on Thursday, doubling in 12 days. Meanwhile, United Nations health experts say that a mental illness crisis is looming as millions are forced into isolation, poverty and anxiety by the pandemic. Nurses from Manipur working at Pantamet Hospital at Delhi's model town have been tested positive for COVID-19. According to our Delhi correspondent, the 4 nurses are staying together in a rented accommodation in the national capital. Talking to our correspondent on phone, one of the guardians of the patients said that they all have quit job but not able to come out due to situation. He urged the government to look into their plight.
Moi ahanbagi ama oigredana aduga moise akoi na moisina mu kamai tawgada yumda tholani hadi yumlomda oina chatlage hadi sigi kaino si pulak lorakana oina changage na khanbagi ko aduna moisina kamai tawgada moina resignation pireba kangusina aduga kangusina resignation pira leiraga ngasai gi maraksida kamai moi symptom ji horokpaneba kaya sum horedana horokosida moi doctor ge sida haiba doctor ge sida haigan ja test enoi matam je kaino test tawgai matam watli haina haibiba moise aduga ngasai symptom ji moise nurse kanggunina kharadi sum khidang tingnabam di sum yaba ado leira kote moisina tumina manaraga mabana test tawga chatpa sida amu test se kamai tawgeda test chatpa ga jami kanamna ese tawida ba kai doctor na refer tawga natabanina direct hek tanga test tawbiu haibu khara luba ado last mafam amadi phangaga ado da test tawga na khangmane haiba moi tara sigi manungda result se ahum je positive oire haina haiba so yaraga de moi so hajike maru oina akhoi aina sum the moi hajike mi lei thungabam je aji khitang kaino tawbiragadi hadi manipur sarkar gi mi je khitang thinglaga ko sadi ani akhoi moi da nate mi atop sum mayam jarak to ni sida khitang kaino to yin din diraga mating pidadi yam nungai ga haina khale any problem da su akhoi na mai lu kan lei na ga chatpa oiragadi any problem le ko matamda ade khitang support to phangara haina sum thajaba maina khanjai tare mena.
Manipur reported a fresh case of COVID-19 on Thursday after a 31-year-old man who returned from Mumbai tested positive for the virus. Official sources said the COVID-19 patient is the son of the Manipuri woman who succumbed to the virus in Mumbai on May 6. The 31-year-old from Imphal East district arrived in the state on Wednesday by road in a private vehicle. He was accompanied by 4 others, including his father, who is a cancer patient. 5 of them were evacuated to a quarantine center in Imphal East district on Wednesday. Of the 5 samples sent for testing at the laboratory in Jawaharlal Nehru Institute of Medical Sciences, JNIMS, the sample of the 31-year-old was tested positive for the virus on Thursday. He, the patient, along with his late mother, had gone to Mumbai city for the cancer treatment of his father. The patient has been evacuated to isolation ward of JNIMS hospital. An official statement from the Manipur Health Department said that contact tracing and active surveillance in the containment zone has begun with immediate effect. The World Bank has approved $1 billion for India as Social Security Technology Fund for countries' urban poor and migrant workers during the coronavirus crisis. This takes the total commitment from the World Bank towards emergency COVID-19 response in India to $2 billion. A $1 billion support was announced last month to support India's health sector. The focus will be to enable India to integrate all of its 400-plus social security schemes at a technology level, the bank said. The project will be crucial to rebalance social security towards urban poor as much as rural, said Junaid Ahmad, Country Director, World Bank. Of the $1 billion commitment, $550 million will be financed by a credit from the International Development Association, IDA, the World Bank's concessionary lending arm, and $200 million will be a loan from the International Bank for Reconstruction and Development, IBRD, with a final maturity of 18.5 years, including a grace period of 5 years. The remaining $250 million will be made available after June 30, 2020. Now let's take a short commercial break. Do stay tuned for more updates.
Langol View Charitable Clinic haina khangnaram mafam asi Lamjingba Hospital and Medical Research Institute Private Limited haina khangnarakani. Mafam asida medicine, gynecology, surgery, orthopedic, ENT amadi pediatrics ka mari lenaba analayingi service singi khudong chava lobiyo. Akupa marol gidama contact tobiyo Lamjingba Hospital and Medical Research Institute Private Limited, RIMS Southgate near Kombinay Kaithel. Hospital helpline number 8258967890.
Welcome back. In a land dispute, 2 persons sustained injury in a firing incident at Mantri Pantha village of Chandel district yesterday. According to our correspondent, the injured person were identified as Saint Jangring Anal, age 47 years, and Santi, age 40 years. Both are residents of Lambung village in Chandel district. The incident happened when a group of people numbering about 50 attacked a group of villagers of Lambung who were returning home from the field. Sources believe the attackers were from Mantri Pantha who were armed with barrel guns. A team of Chandel District Police and Manipur Rifles and Chandel Sub-Divisional Officer, Chandel Deputy Commissioner and the District Superintendent of Police rushed to the site and managed to control the situation. An FIR has also been lodged against Mantri Pantha villagers and their chief. Meanwhile, the District Magistrate Chandel has imposed curfew under Section 144 CRPC in the trouble-hit area. People Action for National Democratic Movement, Pandam, provided relief materials to security personnel, medical staffs and Imphal Municipal Council employees. Pandam President Sapamacha Dilip Kumar said that the social distancing norm is for the safety of the people and everyone must be sensible about the COVID-19 outbreak. Distribution of relief materials amid the COVID-19 lockdown under the supervision of Konthausam constituency, MLA Dr. Sapam Ranjan concluded yesterday. The relief materials were distributed to the households of 41 polling stations under the constituency. Around 10,875 households of 41 polling stations received the relief materials during the 8-day distribution works by workers of the Konthausam BJP Mandal. A team of Imphal West Police under the aegis of Superintendent of Police, Imphal West detained more than 50 persons for defying COVID-19 curfew and lockdown rules at Kwakatel in Imphal today. Satkatar Seva Manipur and Yoga Niti Society Manipur Oinam branch today jointly held an awareness program on COVID-19 at the hall of Royal Academy of Law, Oinam. At the occasion, essential edibles were also distributed to selected 60 media persons working at the different media houses in Bishnupur district. Satkatar Seva patron member Ranbir Singh Garcha, Yoga Niti Society Manipur Oinam branch founder and principal of Royal Academy of Law, Oinam, L. Jugesor and several others attended the event. Continuing distribution of relief materials to public during the ongoing lockdown, Organizing Committee Convener of World Meitei Convention 2020, Jingsuvam Navakumar along with Reception Committee President Lamargram Kasar Moirang Them Nilamadav and other distributed food items to 110 Meitei households in Kasar district, Chatla village yesterday. Hearing Relief Center for the Welfare of Differently Abled Persons Manipur along with Department of Social Welfare, Government of Manipur and Amuko provided hearing aids, crust and relief material to one Hizam Jivant of Nongring under Lamlai constituency. US philanthropist Bill Gates has said that India has a key role in combating coronavirus pandemic globally. He said this during an interaction with Prime Minister Narendra Modi via video conferencing today. The co-founder of technological giant Microsoft discussed the global response to COVID-19 and the importance of global coordination in scientific innovations and research to combat the pandemic. During the discussion, Modi underlined the conscious approach that India has adopted in its fight against the health crisis. He explained how this people-centric bottom-up approach has helped with acceptability for physical distancing, respect for frontline workers, wearing of masks, maintaining proper hygiene, and respecting lockdown provision as per a media report. Modi appreciated the health-related work being done by the Gates Foundation, not only in India but also in many other parts of the world, including for coordinating global response to COVID-19. Before we close, let's see the top news headlines once again. Finance Minister Nirmala Sitharaman to announce third tranche of stimulus package today. Delhi records highest single-day COVID-19 spike with 472 cases on Thursday. (1,061) Maharashtra police personnel have tested COVID-19 positive so far. And World Bank approves $1 billion for India as social security fund for urban poor migrants. That's all for the moment. Thank you very much for joining us and keep watching Times of Manipur News Update and have a good day ahead.
Dear beloved friend Sujata Sapam, why did you have to go so soon? Our hearts are broken forever into 1,000 pieces that will never come back together. Those special memories of